Dr. Krista Keller. Welcome to Vet Inspo Talks. I'm excited to have you, an associate professor of clinical zoological companion animal medicine and surgery at the UC Davis Vet School, on the show with us today, where we'll dive into how to get involved with zoological medicine and what this field entails. So could you tell me a little bit more about yourself?
Oh, about me. Well, I'm a crazy veterinarian with that crazy title. I am a mom, and I'm a first-generation faculty member. Nice. So neither of my parents went to college and still don't quite understand what I do. And yeah, I teach. I work on crazy species, as we'll talk about. I do research and try to balance that with kids at home and just being a human being these days. So
You just do everything now.
Yeah, I guess so. Yeah, some days.
Awesome. So when we're talking more about how to get involved with zoological medicine, what's the journey one has to take to become a veterinarian in this field?
Yeah, so veterinary medicine, pretty competitive. You have to really like school, get good grades, go to undergrad, and then decide that you want more. And that takes a particularly crazy person. And then to be in zoological medicine, to do specialty veterinary medicine, most people go on to do additional training after the 4 years of vet school. So after 4 years of vet school, I did an internship year and then 3 years of residency before I took my board certification and then called myself a board specialist in zoological medicine. That's not to say that every veterinarian needs to be a specialist. A lot of veterinarians end vet school with their DVM and they say, enough is enough. I want to go and live my life. And that is great as well. We have a lot of generalists who aren't specialized, who work on a lot of different species as well. So there's multiple paths within vet med to kind of get to zoo med, which is my flavor of vet med.
And what made you continue, those extra 4 years after vet school?
I have to go back in time here. The way I tell the story best is that zoo medicine chose me. I didn't choose it. When I went to veterinary school, I was actually a latecomer to vet med. A lot of people who want to be a veterinarian kind of know they have this great story, or their parents tell a story. They're 4 years of age and they're like putting bandages on their stuffed animals. That was not me. I didn't know I wanted to be a veterinarian until I was in my 20s. So I was in undergrad, I was pre-med, and kind of people around me started telling me like, I don't think you're supposed to be a human doctor. I think you're supposed to be a veterinarian. And I was like, I don't know why people think you know me. But they were right. I was supposed to be a veterinarian. And then when I went to veterinary school, I kind of went not really knowing the veterinarian that I wanted to be. And maybe that's because I didn't have an entire 20 years to develop that idea. Yeah. But I went in with really open eyes and just said, I want to experience everything. I want to try everything. I want to rule out what I don't want to do within this really large field. And so for a while, I was on like the beef cattle club. That didn't go great for me. For a while, I was like, maybe it's neurology, No, definitely not. And it just so happened that there was a club meeting for the zoo club at my school, and I was like, oh my goodness, this is it. This is really interesting. Yeah. And so it kind of chose me, if that makes sense. I don't think I had any control in the process.
Yeah, awesome. And then what would you recommend someone should do in terms of experience if they are interested in this field?
Yeah, so I think if you're in undergrad level and you're thinking about veterinary school, explore all the facets of veterinary medicine. There's a ton of them. Get some experience shadowing somebody doing small animal medicine and equine medicine. There's also laboratory animal medicine. And on a big campus like this, there's actually all of those experiences available. Doing wildlife biology work and, helping out with a research project with the Department of Herpetology. Anything that gets you hands-on animals really is going to help you figure out like, yes, I do want to do this. I do want to get pooped on every day, or I'm not afraid of needles and I'm not afraid of blood, those sorts of things. And it helps you just kind of find your way. So get as much experience as possible. Find a unofficial mentor that, has lived the life and gone through it and talked to them, about what's going on. And, put your nose in the books. Unfortunately, it is a part of it is that, it is a really scholarly endeavor where you need to study a lot, you need to learn a lot so you can apply a lot to get there.
True,
but it's doable. It's all doable. It's all doable.
Yeah. And then you were saying this is for undergrads. Mm-hmm. So what would you say for vet students?
Vet students who want to go into zoo med, that's a great question as well. I still, a lot of I talk to a lot of vet students who are in their first or second year and they're like, I want to do zoo med. And I'm like, do you know that you want to do zoo med? There's so many facets of veterinary medicine, and zoo medicine is just everything that doesn't fit in with dog, cat, horse, cow. But as a zoo medicine veterinarian, I have to rely on ophthalmologists and cardiologists and surgeons to really take my cases to the next level. So whereas I'm I guess, all species expert, I'm not, that's just my title, I guess. But, I really rely on individuals who have done more of an organ specialty to really, really help. And so sometimes I talk to people, I'm like, what's your other passion? And people say to me like, I love eyeballs. That's weird to me, but that's okay. I love that they have that knowledge. Lots of times I think that they can do more for all species by being an ophthalmologist and being an ophthalmologist who truly wants to look at all eyes and help all patients of all species. And so, I try to help people understand that it's not just what my job is. Sometimes I wish that I had, a little bit of a deeper dive into some other facet of veterinary medicine that we're all doing zoo medicine all the time, even if that's not our distinct title. And with more integration and more people passionate about an all species approach, we can serve all animals all the time better. So yeah, I think opening your eyes, seeing all the opportunities that are there, not saying no to any opportunity. My tell that I tell to a lot of veterinary and pre-veterinary students was that I got AI certified, so artificial insemination certified to service cattle. Because in vet school, it was an opportunity. It was like a weekend course. And I was like, I don't know. That might be what I just really love. I definitely walked away from it saying, wow, that was a lot. I don't know that I'll use that. But there are some skills that I picked up there and some knowledge I picked up there that I used later. So just keep the blinders off. Let life happen. Let life influence you. Let the opportunities influence you. And you'll blossom into the veterinarian you're supposed to be, I guess.
Yeah, that's great advice. There you go. Yeah, that's really great advice for, some students who are not particular of what they want to study right now. They're just trying new things. And, as you said, life, will pass by and you'll find something. And that's true. In terms of zoological medicine and what it entails, so you were saying that you work with many species. Mm-hmm. What types of species do you work with?
What species don't I work with is an easier list. So zoological medicine is huge. Usually when I say I'm a zoo vet, people say, what zoo do you work for? And, I kind of look at them and I'm like, I don't work for a zoo. I, in fact, work for University of California, Davis. But there are zoo veterinarians who work kind of in that traditional sector in zoo medicine or in aquarium medicine. There are zoo veterinarians who work with wildlife, like populations of wildlife that are affected by, right now there's an avian influenza outbreak, So responding to that, there's wildlife rehabbers who are like individual birds and helping them fly again. And then there's me. So I am a zoologic companion animal veterinarian. So I work with all of the weird and wacky species that are part of people's families.
Basically.
So maybe the pet rabbit, a parrot, fish, and whatever else people think is a pet. Part of my personal zoo at home, we have 2 turtles and a leopard gecko. They are family members. And so I work with just any species, any animal that's part of people's homes, part of people's families.
I heard from experience that getting into the zoological field is very difficult in terms of competitiveness. What do you think? What do you say? Like, especially in a zoo setting.
Yeah, I mean, there are definitely limited at zoo positions. But if you think about zoo medicine a little bit more globally, there's a ton of people who are in private practice practicing zoo medicine because they see 50% dogs and cats and 50% whatever else is in people's homes. There are people in private practice who see maybe 75% dogs and cats, and then they have a contract with a local aquarium or zoo that is a smaller institution. Those animals still deserve and benefit from veterinary care, but they don't have enough of a workload for a full-time veterinarian to be on staff. So there's tons of opportunities for zoo medicine. And again, if we go back to zoological means animal. It means all animals. And here at UC Davis, at a lot of institutions, our students are trained to treat animals, And so we're all zoo med. We're all zoo med, yes.
Basically, that's true. Yeah. And how does this feel different than any other veterinary specialties?
How is it different? I think my position as a zoo med specialist is I'm a generalist specialist. So I know, my depth is like an inch deep, but a mile wide, because it's everything from fish to elephants, hypothetically. Wow. Whereas, cardiology is a real deep dive into cardiovascular structure and function and disease and treatment and all of that. And so it's a really different kind of look at things. And I was kind of getting at that before, is that it's really nice to partner with a team of veterinarians who has a deep dive into something like the brain or, cardiopulmonary function, so that my cases can really benefit from that. So I think that's a difference. Is lots of times people say to me like, oh, well, what's going to happen with, this rabbit's disease process? And my answer is legitimately, I don't know, because potentially in my field, nobody knows. It really is. There's a lot of discovery that we have to go through as we learn more. We're behind in terms of discovery and knowledge from dogs and cats, and then even further behind than humans in understanding human disease and medicine. So I think it's kind of like I think other specialties look at us as like the Wild West, like we're some sort of cowboys and cowgirls out there on the frontier. Sometimes it feels like that. Most of the time, I think our days are pretty routine. Patients come in, they need care. We try to find a way to diagnose their disease, treat their disease, make sure that they're happy, healthy as possible, and get them out the door, So there's a lot of similarities as well.
Yeah, that makes sense. Yeah, I get that. And then this is the question that I always ask all my speakers. Mm-hmm. So what would you tell your younger self if you can go back in time, and why?
Okay. Definitely to not sweat the small stuff. Yeah, I think it's really easy. When I was younger, and I hear this from a lot of younger people early in their careers now, is that there's so much pressure. Yeah. And some of that pressure is external from family and friends, but a lot of it is internal. We put these pressures on ourselves that we're supposed to meet these deadlines for life. And, we're supposed to be going on these epic vacations and wearing these outfits and having the hair and doing all this. And we put all this pressure on ourselves. And long term, 20 years down the road, the things that you remember are truly the journey, the people you're around, the really novel experiences that you had, even if you don't realize how novel they are at the time. So I wish I could have given myself a chill pill. All of my 20s could have been a chill pill, and it would have been a much better experience for myself back then.
Yeah, because another speaker was saying that, all the vet students and pre-vet students, they all want to do amazing. They're all like go-getters, and we always have pressure on ourselves. So that's, I think, great advice to tell them right now in their early 20s, just that everything is going to be okay. And yeah, that makes sense.
I mean, I think sometimes it would be nice to just write a state of yourself once a year, and then look back every year and be like, oh, I've progressed, because we don't always realize how great we're doing and how much we're growing and how much we're learning. We need to give ourselves a little bit more credit.
That's true.
All of us.
That is true. Well, thank you so much for speaking to us today.
Of course, thank you.
It's been great having you on the show today, sharing your insightful knowledge with us. And then for our audience, thank you for watching and see you next time on Vet Inspo Talks. Bye!